Hello, this is a speech and language therapy tutorial on monitoring children's speech, language and communication. My name is Maeve and I am one of the early years speech and language therapists. This tutorial will cover how to use the CLCH Early Years Monitoring Tool. This tool has been produced by the Central London Community Healthcare NHS Trust Early Years Speech and Language Therapy team. It is based on typical developmental milestones and provides a speech, language and communication guide for children from birth to 5 years of age. If you are concerned about a child's speech, language or communication, use this tool to decide what support will be most suitable. Supporting children with English as an additional language. Having English as an additional language does not cause a developmental or language delay. It is important that you assess the child's speech, language and communication development in their strongest language when using this tool. It may be useful to complete a copy of this tool with the child's parents to gain information about the child's development in their home language and how they communicate at home. So, how to complete the monitoring tool? It may be helpful to have the monitoring tool open while I talk through the next slides. At the end of this tutorial, I have included a completed example of the tool. Step 1. Gather information. This may be done through observation. Observation involves noticing what the child is doing and saying in a range of contexts, for example, in their nursery, at the children's centre, or at home. As mentioned previously, it may be important to have a discussion with the parent or carer to gather further information about what the child is doing at home. It is advised, however, that you do not provide the monitoring tool to a parent or carer to complete themselves. Instead, gather information from the parent or carer through discussion if needed. Step 2. Age. Check the child's age in years and months and start completing the tool for the appropriate age band. If a child's age does not fall exactly into an age band, you may need to complete more than one age band. You do not need to complete all age bands. In some cases, however, it may be helpful for you to complete age bands below and or above the child's age. For example, if you have ticked most of the behaviours for their age as sometimes or not yet, you may wish to look at the age band below to get an idea of the skills that they can do most of the time. Step 3. This flowchart will support you in completing the monitoring tool. As mentioned, determine the child's age in years and months. Does their age correspond exactly with an age band on the form? If so, complete the age band that corresponds to the child's age. If not, then the child's age falls between two age bands. In this case, complete both age bands. So for example, if the child is 20 months, complete both the 18-month and 24-month age bands. Across the age bands you have completed, have you ticked 2 or more boxes on the When to Refer to SLT column, so the yellow column on the right-hand side of the monitoring tool? If so, this suggests there are significant concerns regarding the child's communication skills, and a referral to early years speech and language therapy is highly recommended with parental consent. If not, then you can check if you have done both or either of the following. Have you ticked 50% or more of the boxes as not yet? And or have you ticked none of the boxes as most of the time? If yes, this would also suggest that there are significant concerns regarding the child's communication skills, and a referral to early years speech and language therapy is highly recommended with parental consent. If not, you can continue on to step 4. Step 4. If you have ticked a mix of boxes as sometimes and not yet, with some boxes ticked as most of the time, this suggests there are moderate concerns regarding the child's communication skills. The sometimes and not yet areas you have ticked will be what you can support the child with. Some ideas of what to do in this situation would include referring the child to the targeted groups running in their local children's centre. Or if you are working with this child in a nursery setting, you could introduce specific support, such as a regular language group focused on supporting the areas ticked as sometimes and not yet. If you have ticked most boxes as most of the time, possibly with some boxes ticked as sometimes, this suggests there are mild or no concerns regarding the child's communication skills. It is important that parents, nursery, and children's centre practitioners continue to support language development. You may direct the parent or carer to drop-ins or stay-in plays in their local children's centre. Step 5. Re-rating the monitoring tool. When you complete the monitoring tool for a child, it is important to re-rate the monitoring tool at a later point, so to measure change. It is important to think about how much time you will allow between ratings. If you are working in a nursery, it may be helpful to do this termly, or maybe after an episode of intervention, such as several weeks of a language group you put in place, for example. If you are working in a children's centre, you may also re-rate the tool after an episode of intervention. For example, if you were running targeted groups, you would complete the tool at the beginning and at the end of the targeted groups. Your re-rating would inform your next steps at that stage, as per the flowchart. If you put a plan in place to support the areas a child was having difficulty with and you see no change at the point of re-rating the tool, a referral to speech and language therapy may be necessary. This is an example of a completed monitoring tool. The details provided are not of real people and have been created for the purpose of the example. At the top of the monitoring tool, there is a section to complete general information. You would start by filling this in. As you can see, there is space to provide details of any additional languages. There is also space to make note of several different dates of completion. When you re-rate the tool at a later date, you could do so using a different coloured pen so to see the different ratings clearly. As this child is 2 years and 6 months, the 2 years age band was completed first. The 3 years age band was also completed as the child's age fell between both age bands. Across both age bands, one box has been ticked in the When to Refer to SLT column. A mix of most of the time, sometimes, and not yet boxes have been ticked across both age bands. Following the flowchart in Step 3, the information would lead us to Step 4. Following the guidance in Step 4, this child would benefit from a referral to their local targeted groups. At the bottom of the monitoring tool, there is space to complete the actions and add any comments that may be helpful. On this example, it has been noted that the child is not yet attending nursery, however will do so when they turn 3. When this child attends their local targeted groups, the practitioners and speech and language therapist running the groups can look at the monitoring tool completed by the referrer and see the areas the child needs support in. If the child had been referred and the monitoring tool had not been completed by the referrer, the practitioners and speech and language therapist would complete the tool at the beginning of the block of groups the child is attending. When the block of targeted groups ends, the practitioners and speech and language therapist can re-rate the tool and see if the child has made progress since the first rating. Depending on the child's re-rating, the practitioners and speech and language therapist would decide together the best next steps at that point. If no change has been seen, a referral to speech and language therapy may be considered, and/or the child may benefit from attending other sessions in the children's centre to prepare him for starting nursery, for example. The next steps at the point of re-rating will vary for every child.